So in the overview segment, I was describing how thoughts and emotions have the capacity to influence pain, either for better or for worse. Our thoughts and our feelings influence our experience of pain. And I want to talk very specifically about a psychological construct that is shown to have an incredibly powerful influence on sensory perception, and that is pain catastrophizing. There is about a quarter century of research that shows that pain catastrophizing is one of the most important determinants of pain outcomes, for pain outcomes. So pain catastrophizing is going to influence how a person responds to pain treatment. And this psychological construct is comprised of three factors. So pain catastrophizing is when we ruminate about pain, it's when we magnify pain, like we're not able to think about anything other than the pain and how awful it is. And that leaves us feeling very helpless about our pain. So it's magnification of pain, rumination about pain, and feelings of helplessness about pain. And together these three factors are what comprise this construct that we call pain catastrophizing. And it turns out to be quite toxic in terms of pain itself, because it has such a negative influence on pain and also related outcomes for pain. So the way that we measure catastrophizing is we give a questionnaire that's been scientifically validated for this purpose. And we're able to tabulate a score and then determine where a person falls on a continuum of pain catastrophizing. And what we know is that people who are on the higher end of catastrophizing, we just simply call them catastrophizers. People who are catastrophizers experience greater pain intensity. And that's somewhat unsurprising, because when we catastrophize, we're actually feeding our own pain experience unwittingly and unknowingly, but that's actually what's happening. So people have greater pain intensity. They have a greater need for pain medication, so opioid medication, for instance. They're going to need and use more opioid medication. People who catastrophize have poorer response to multidisciplinary pain treatment. So they just simply get worse outcomes for various pain treatments. Couple of pieces of information that are particularly interesting is that catastrophizing is associated with a longer length of hospital stay. So if you go into the hospital for any reason and you are a catastrophizer, you are more likely to need a longer stay in the hospital than someone who does not catastrophize. And lastly, catastrophizing has been shown to actually predict the development of chronic pain. And so there was actually a couple different studies that have looked at this, and they look at people prior to surgery, and they measure whether they have a tendency to catastrophize or not. And then everyone goes through and has a surgery, let's say it's a knee surgery, and then researchers will determine who recovered from the surgery and who went on to acquire chronic pain, post-surgical chronic pain. And what the research shows is that catastrophizing predicts whether or not a person acquires chronic pain following surgery. So catastrophizing is very potent. It is an exquisite example of the mind-body connection, that the power of the brain, our mind, our thoughts, and our feelings, and the power of our thoughts and our feelings to determine our pain experience and to determine the trajectory of our pain. It doesn't just determine what we feel in the moment. Catastrophizing has the capacity to determine how long our pain lasts, whether our pain becomes chronic or not. And so for this reason, it is incredibly important that we determine whether or not a person is a catastrophizer. And if they are, we want to treat it. This is a treatable phenomenon. And so a person can work work with a pain psychologist or another provider to acquire a skill set in which a person learns to calm their mind and calm their body. And they can also learn ways to think differently, to think in a more helpful way. We use specific techniques. We call them cognitive behavioral therapy techniques. And these are learnable, and it's literally a question of learning the right skills and then implementing them on a daily basis. And if a person is able to do that, you can literally change your brain and the way that your brain is processing information. And this is of vital importance because all pain is actually located in the brain. It's where we process sensory information, and it's where we process our cognitive and emotional information. And all of that's happening in the same place, and it's all related. And so by learning these specific techniques, we can learn a way to put a container around catastrophizing. We can learn to stop catastrophizing and actually reverse some of these patterns so that we are having less pain, better response to pain treatments. Ideally, we will need less pain medication, and we will simply be more comfortable and more in control.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.